Every symptom of vitamin D deficiency explained. Symptom: unpersistent fatigue. You sleep 8 hours and wake up tired. You are tired by midday. You are tired after doing nothing. This is not laziness. This is biochemistry. Vitamin D plays a direct role in mitochondrial function, the process by which cells convert oxygen and nutrients into usable energy. When vitamin D levels are low, mitochondrial efficiency drops. The cells produce less ATP, the body's energy currency, even when nutrition and sleep are adequate. The fatigue is not from lack of effort. It is from a cellular production failure. A 2014 study in the North American Journal of Medical Sciences found that correcting vitamin D deficiency in fatigued patients led to a significant improvement in energy levels in 89% of cases within 3 months. The fatigue was not psychological, it was a measurable physiological response to a deficient nutrient. The fatigue of vitamin D deficiency has a specific character. It is disproportionate to activity. A short walk exhausts. Standing in a queue becomes tiring. Sleep does not restore energy the way it once did. If this pattern has been present for months without a clear diagnosis, a vitamin D blood test is the most logical first step. Symptom 2: bone pain and muscle aches. A deep, dull ache that lives in the bones, not the joints, not the muscles, but the bones themselves. Most people are told it is fibromyalgia, aging, or stress. In many cases, it is untreated vitamin D deficiency. Vitamin D is essential for calcium absorption in the gut. Without adequate vitamin D, the intestine absorbs only 10 to 15% of dietary calcium compared to 30 to 40% with sufficient levels. To compensate, the parathyroid gland releases parathyroid hormone, which pulls calcium out of the bones to maintain blood levels. The bones become progressively demineralized, softer, more porous, and more painful under pressure. This condition is called osteomalacia in adults, distinct from osteoporosis, and it produces a characteristic tenderness when firm pressure is applied directly to the sternum, tibia, or forearm bones. A physician who presses on the shin bone and produces significant pain is looking directly at a sign of vitamin D deficiency. It is a clinical finding, not a vague complaint. Muscle aches accompany the bone pain because vitamin D receptors are embedded in muscle tissue. When those receptors are understimulated, muscle fibers produce less force, fatigue faster, and develop a diffuse achiness that is widespread rather than localized. This combination, bone pain plus muscle aches plus fatigue in the absence of another diagnosis, is a near-classic presentation of deficiency. Symptom 3: frequent illness and infections. You catch every cold that passes through the office. A virus that lasts 3 days for everyone else takes you 2 weeks. Your immune system is not weak by chance. It may be missing a critical input. Vitamin D is one of the most potent modulators of immune function identified in modern medicine. It activates T cells, the immune system's primary attack cells, and stimulates the production of antimicrobial peptides called cathelicidins and defensins, which directly destroy bacterial and viral cell membranes. Without adequate vitamin D, this first-line immune response is blunted before it even begins. A landmark meta-analysis published in the British Medical Journal in 2017, covering 11,321 patients across 25 randomized trials, found that vitamin D supplementation reduced the risk of acute respiratory infection by 12% overall and by 70% in people who were severely deficient prior to supplementation. The protection was most significant in those who supplemented daily rather than in large, infrequent doses. Vitamin D deficiency is also strongly associated with increased susceptibility to autoimmune conditions, where the immune system, poorly regulated without sufficient vitamin D signaling, begins attacking the body's own tissue. Multiple sclerosis, rheumatoid arthritis, and type 1 diabetes all show geographic distribution patterns that correlate precisely with reduced sun exposure and lower average vitamin D levels. Symptom 4: depression and low mood. A sadness without a clear cause. A flatness that medication hasn't touched. A winter that feels darker than it should. Vitamin D receptors exist throughout the brain. When they go unstimulated, the brain notices. Vitamin D regulates the synthesis of serotonin, the neurotransmitter most directly associated with mood stability, motivation, and emotional resilience. It does this by activating the gene that controls the enzyme tryptophan hydroxylase 2, which converts tryptophan into serotonin in the brain. Low vitamin D means lower serotonin production. Lower serotonin means lower mood independent of life circumstances. A 2013 meta-analysis in the British Journal of Psychiatry, reviewing 31,424 participants, found a significant association between vitamin D deficiency and clinical depression. Individuals with the lowest vitamin D levels had an 8 to 14% higher risk of depression compared to those with sufficient levels. Seasonal affective disorder, the depression that appears in winter months with reduced sun exposure, is widely understood to be at least partially driven by the seasonal drop in vitamin D production. This is not to say depression is always a nutrient deficiency, but in a person who has not responded fully to standard interventions, whose mood is consistently worst in low sunlight months, and who has never had vitamin D levels tested, a blood test costs almost nothing and may change the entire treatment picture. Symptom 5. Hair loss. Losing more hair than normal. Thinning that started gradually and keeps progressing. Stress gets blamed. The real trigger may be nutritional. Vitamin D receptors in hair follicles play a direct role in the hair growth cycle, specifically in stimulating the anagen phase, the active growth period. When vitamin D signaling is absent or insufficient, follicles spend more time in the resting phase and less time actively producing hair. The result is diffuse thinning across the scalp rather than patterned baldness. A 2019 study in the International Journal of Dermatology found that women with female pattern hair loss had significantly lower vitamin D levels than controls with levels below 30 ng/ml, showing the strongest correlation with severity of hair loss. Alopecia areata, the autoimmune condition that causes patchy hair loss, is also strongly linked to vitamin D deficiency, consistent with the vitamin's role in immune modulation. Hair loss from vitamin D deficiency is reversible with correction, but only if addressed before the follicle itself is permanently damaged. 6 months of consistent deficiency can shift a follicle from recoverable to dormant. This is why hair loss that is new, diffuse, and unexplained warrants a full nutritional panel, not just a topical treatment. Symptom 6. Slow wound healing. A cut that takes longer than it should. A surgical site that heals slowly. Skin that seems reluctant to close. Vitamin D directly regulates the production of compounds essential to wound repair, including growth factors that stimulate new skin cell formation, anti-inflammatory cytokines that control the healing process, and cathelicidins that protect the open wound from infection. When vitamin D is low, each stage of healing operates below capacity. A 2017 study in the Journal of Dental Research found that patients with vitamin D deficiency had significantly slower healing following oral surgery, with measurably reduced collagen formation at the wound site. Collagen is the structural protein that closes and strengthens healing tissue. Without adequate vitamin D signaling, the fibroblasts, the cells responsible for producing collagen, underperform. In diabetic patients, whose wound healing is already compromised by reduced circulation and immune function, coexisting vitamin D deficiency compounds the problem significantly. Research shows that diabetic patients with sufficient vitamin D levels heal chronic foot wounds at twice the rate of those who are deficient. Optimizing vitamin D in a patient with a non-healing wound is one of the lowest cost, highest impact interventions available. Symptom 7. Brain fog and difficulty concentrating. Thoughts that feel slow. Words that won't come. A concentration span that has quietly shortened over months. Vitamin D does not just affect the body. It actively maintains the brain. Vitamin D receptors are found throughout the hippocampus and prefrontal cortex, the brain regions responsible for memory formation, attention, and executive function. Vitamin D supports the production of nerve growth factor, which maintains the health and connectivity of neurons. It also regulates the clearance of amyloid beta, the protein that accumulates in Alzheimer's disease. Low vitamin D does not just impair thinking acutely. It creates conditions for long-term neurological decline. A 2014 study in JAMA Internal Medicine followed 1,658 adults over 6 years and found that those who were vitamin D deficient were 53% more likely to develop dementia and 70% more likely to develop Alzheimer's disease compared to those with sufficient levels. The association held after controlling for physical activity, cardiovascular risk, and depression. On a day-to-day level, the brain fog of deficiency is described as a consistent difficulty holding focus, a sense of mental slowness, and a reduction in the ability to process multiple things simultaneously. It is not dramatic. It is a baseline that has quietly lowered, often so gradually that the person adapts to it without recognizing it as a symptom at all. Symptom 8. The serious consequences and what to do now. The symptoms we've covered, fatigue, pain, low mood, brain fog, are the body running low. What comes next is the body breaking down. Severe, prolonged vitamin D deficiency causes rickets in children, the softening and deformation of developing bones. In adults, the equivalent is osteomalacia bones, so demineralized they fracture under normal daily stress. Stress fractures in the metatarsals, pelvis, and spine from vitamin D deficiency are increasingly common and are frequently misdiagnosed as sports injuries or age-related fragility. Vitamin D deficiency is also independently associated with increased risk of cardiovascular disease. A meta-analysis of 34 studies covering over 180,000 patients found that individuals in the lowest quartile of vitamin D levels had a 35% higher risk of cardiovascular events compared to those with sufficient levels. The mechanism involves vitamin D's role in regulating blood pressure, inflammation, and arterial stiffness. The diagnosis is simple. A 2,5-hydroxy vitamin D blood test gives a precise level in minutes. Sufficiency is defined as 30 to 100 ng/ml. Deficiency is below 20 ng/ml. Severe deficiency is below 10 ng/ml, a level at which bone loss, immune collapse, and cardiovascular risk all accelerate measurably. These are the situations that require prompt medical attention, not just a supplement from the pharmacy shelf. 1. Bone pain so severe that it disrupts sleep or limits walking. 2. Muscle weakness significant enough to cause falls or difficulty rising from a chair. 3. A confirmed level below 10 ng/ml. This requires supervised high-dose correction, not standard over-the-counter dosing. 4. Symptoms of hypocalcemia from prolonged deficiency. Muscle spasms, cramping in the hands and feet, or tingling around the mouth. 5. Children showing delayed walking, bowed legs, or soft skull bones. These are rickets and require immediate pediatric evaluation. Here's what makes vitamin D deficiency uniquely frustrating. It is one of the most correctable deficiencies in medicine. A blood test, a supplement, and in most cases, modest changes to sun exposure and diet can reverse years of symptoms within 3 to 6 months. The problem is never the solution. The problem is the years spent not knowing what the question was. Tired for no reason, aching for no reason, low for no reason, sick more than you should be. Now you have a reason, and now you know exactly what to do with it. Which of these symptoms have you been experiencing? Tell me in the comments below.